we have now administered more than 734,000 doses of vaccine in the province. Over the last 24 hours, we have identified 931 new cases of COVID-19 and completed about 9,100 tests. This puts our positivity rate at about 10.2%. Over the last 24 hours, we have identified 676 new variants of concern. There are currently outbreaks or alerts in 413 schools, which is 17% of all the schools in the province. There are 328 people in hospital for COVID-19 treatment, including 76 admitted to the ICU. Sadly, 3 additional deaths were reported to Alberta Health in the last 24 hours. These people's lives mattered, and they will be missed. My thoughts are with anyone who has lost a loved one during the COVID-19 pandemic, whether to the virus or any other cause. I also want to let you know that due to an increase in COVID-19 cases in the Bow Valley area, including Banff, Lake Louise, and Canmore, including 3 variant cases, AHS is working closely with the operators of Lake Louise and Sunshine Village to conduct on-site and community testing of all employees and contractors. At this stage of the investigation, there is no identified single event or cause for this increase in cases. My local colleagues are working hard to prevent future spread and support everyone involved. At this time, we are not recommending precautionary COVID-19 testing for anyone who has visited or skied in the Banff-Canmore area recently. However, if you are symptomatic, as we always advise, stay home, isolate, and arrange for testing. As the Premier noted, cases continued to rise over the weekend. Our active cases have now risen by 27% during the last week alone. Today, about 43% of all active cases are variants of concern, and that figure is rising sharply. I know that many people will be disappointed that we are once again forced to implement aggressive public health measures. I know that bringing in new restrictions can be frustrating when it feels like we are so close to the end. It's natural to be frustrated and to be sick and tired of this pandemic. We all wish these measures were not necessary. But we are at a critical juncture. In the last week alone, we have diagnosed more than 6,700 cases of COVID-19. Our hospitalizations, ICU admissions, and positivity rate have all increased sharply. If we do not take action, fatalities will also rise in the coming weeks. As I mentioned last week, variants of concern present a new challenge, one that we cannot ignore. These variants are not only more contagious, but also, in the case of B117, more likely to cause severe illness. This means that as cases rise, an even higher percentage of younger cases are likely to need hospital care. The good news is that we have shown time and time again that these measures work. By taking widespread steps to limit in-person interactions across society, we stop the spread.
We are continuing to see accelerated growth driven by the variant and concluded that these additional measures were necessary. I'll be honest about this, part of the irony is that the sacrifices made by people that follow the rules, in a sense, is necessary for the minority of people who don't. And so, unfortunately, we have to suspend certain kinds of, let's talk about in-dining restaurants and bars. We know a significant number of cases of outbreaks associated with people table hopping and not sticking to the rules, not sticking to their family cohort, and going from table to table and going from bar to bar. That is not consistent with the rules. So unfortunately, we've had to take an additional step to pause in-dining service. So this is, if there is a significant level of non-compliance, the tools at our disposal are pretty limited. And we are using some of those tools here today.